This presentation provides an opportunity for you to learn the steps in the coding process. It also provides an introduction to the format and use of ICD-10-CM Coding Reference Manual and the structure of the ICD-10-CM code. We strongly encourage you to follow along with the presentation. Before you continue, make sure you have the following resources: your ICD-10-CM Coding Manual, a medical dictionary to interpret medical terminology, and your anatomy and physiology textbook. Are you ready? Let's begin. The ICD-10-CM Coding Reference Manual is the main tool you will use to assign ICD-10-CM codes. It has instructions, symbols, and conventions which must be followed when coding. Take a moment to look at the symbols and conventions located in the first 7 pages of the Coding Reference Manual. This may appear overwhelming to you now, but don't worry. By the end of this week, you will be able to interpret the coding manual. All medical coders must follow the official guidelines for coding and reporting in order to assign ICD-10-CM codes. These guidelines describe the coding process as well as the specific rules to assign diagnostic codes that fully describe a patient's condition and reason for health services. The guidelines you will use to assign a code can be found in Part 1 of the ICD-10-CM Reference Coding Manual. Open up your manual to Part 1 and take a minute to scan the general coding guidelines. Based on the general coding guidelines, there are 8 basic steps in the coding process. Using a case study, this presentation will show you how to follow these steps to assign your first diagnostic code. Pause the presentation and read through the medical document. Pay particular attention to the diagnosis. Step 1 of the coding process is to identify the main term. In order to identify the main term, look at the diagnosis and ask yourself, what is the disease, disorder, condition, or injury? In this example, the main term for the diagnosis is infection. Before you continue, pause the presentation and look up the word infection in your medical dictionary or your anatomy and physiology textbook. At this point, it is also helpful to identify the subterms in the diagnosis. Subterms can describe essential differences by anatomical site, cause or etiology, or clinical type. In this example, the subterms are acute, which describes the onset of the condition, upper, which describes the location, and respiratory, which describes the body system. Step 2 is to look up the main term in the alphabetic index of diseases and injuries, which we will refer to as the alphabetic index. It is Part 2 of the ICD-10-CM Coding Reference Manual. As a reminder, Part 1 of the ICD-10-CM Coding Reference Manual contains an overview of the coding conventions, symbols, and abbreviations, and the coding guidelines. Let's take a minute to review the organization of the alphabetic index. The alphabetic index is divided into the Index of Diseases and Injuries and External Cause of Injuries Index. Within the Index to Disease and Injuries are the Table of Neoplasms and the Table of Drugs and Chemicals. For this case study, you will use the Index to Diseases and Injuries. Turn to the first page of the index. Notice the main terms are bolded and flush with the left margin. In your version of the ICD-10-CM, the main terms are printed in red typeface. Now pause the presentation and try to find the main term infection. You should have found the main term in the alphabetic index under the I section. The main term is listed as infection, infected, infective. Notice there are 3 versions of this main term, any of which may be used in the medical documentation. In our case study, the main term infection matches the medical documentation. Notice to the right of the main term is the term opportunistic in parentheses. The parentheses indicate that the term is supplementary and is only there to provide additional information for the coder. Terms within parentheses are referred to as non-essential modifiers because they do not affect the code that is selected. The code to the right of the main term is the default code, which represents the most common condition associated with the main term. In this case study, the condition is specified as an upper respiratory infection, so we will ignore the default code for now. Once you find the main term, step 3 is used the subterms to further specify the condition. Subterms are identified beneath the main term. In this example, immediately below the main term is the word with. This word is referred to as a connecting word because it indicates a relationship between the main term and another condition. Examples of other connecting words include the word with and the phrases due to, associated with, and with mention of. The connecting word with does not apply to this case study, so you can ignore it for now. As you may recall, the subterms in this case study are acute, upper, and respiratory. So which subterm should you look up first? Quite often the subterm listed under the main term is a body system or body part. In this case, the infection is in the respiratory system. Pause the presentation to locate the subterm respiratory. Hopefully you are able to easily find the subterm respiratory indented below the main term infection. Let's take a minute to look at the entry for respiratory. Notice to the right of the subterm respiratory is the word tract in parentheses. Again, the parentheses indicate tract is a non-essential modifier providing supplementary information. There is also an abbreviation NEC, which means not elsewhere classifiable. This abbreviation appears when more specific codes are not available. Since the diagnosis from the case study provides more specific information about the respiratory infection, you should continue to use all the subterms to further specify the diagnosis. Pause the presentation to look up the other subterms acute and upper. So which subterm did you find? In this example, both acute and upper are listed as subterms beneath respiratory. So which subterm should you use? The trick here is to use a subterm to further specify the etiology, anatomical site, or severity of the condition. The subterm upper specifies the location of the infection within the respiratory system, so it is the better choice. There are additional subterms under upper to further specify the onset, acute, chronic, and the etiology, streptococcal, viral, of the respiratory infection. Since the diagnosis from the case study stated the infection was acute, the entry upper acute is the best choice. Again, notice the word acute is a non-essential modifier that matches a term in the medical documentation. So in this case, it helps us identify the entry that best matches our diagnosis. Before we move to the next step, let's take a closer look at this entry. To the right of the upper acute is another abbreviation, NOS, not otherwise specified. NOS is the equivalent to unspecified. This means that the coder should use this code when the documentation lacks specificity. This abbreviation applies to our case because the provider did not specify the exact part in the upper respiratory system where the infection resides. This is, the infection could be in the nasal cavity, pharynx, or larynx. If applicable, step 4 is to follow the See and See Also instructions in the alphabetic index if the diagnosis and needed code were not located. Since we found the diagnosis, step 4 does not apply to this case study, but let's take a minute to review this step anyway. See tells the coder to locate and use a different term in the alphabetic index. For example, if the diagnosis was a lower respiratory infection, the coder would follow the C instruction to locate and use bronchitis chronic instead. On the other hand, C also directs the coder to reference another term in the alphabetic index to see if the other term is more appropriate. For example, if the respiratory infection was in the pharynx, the coder would be directed to look up pharyngitis to see if it is more appropriate. You have now completed steps 1 through 4. You identified the main term and subterms from the diagnostic statement, then located them in the alphabetic index, resulting in a diagnosis and an associated diagnosis code. The diagnosis is read from the subterm to the main term, so in this example, it is upper acute respiratory infection. The ICD-10-CM code for this diagnosis is J06.9. But we're not finished. Step 5 is to verify the selected code. In this case, J06.9. We'll verify the selected code within the tabular list to ensure it is the correct code. Stop and close the presentation. Turn to the first page in the tabular list of the ICD-10-CM Coding Reference Manual before you continue with Part 2B.